Hi, this is Stephen George here. I've been reading in all the newspapers about this abuse of disabled people, learning disabled in particular, and it reminds me just how little we've changed. From the time of the new Mental Health Act in 1952, when a lot of mental hospitals were considered new and modern, learning disabled people were a group that were placed in these mental hospitals from children to adults. And one of the things, of course, that happened, they were made to work compulsorily, some of them working incredibly hard for mere pence, and they virtually kept the hospital running with the cleaning and helping in the kitchens, working in the gardens. And for those more able, they would help with the less able patients. I myself witnessed so much cruelty from around 1966, where patients would leave the grounds without permission, whether learning disabled or not, and police would bring them back, and it was routine to inject them as a punishment and lock them in a room for a week. And it wasn't done for clinical need, it was done solely to control and frighten. The whole system was corrupt, and some of the patients that we had there would have come from children's homes where they'd been sexually and physically abused, or both. And these same children's homes frequently had important people using the children's home as their private playpen, and these were obviously paedophiles and other groups, and these same patients would then turn up in the local mental hospitals because they'd reported their abuse, and where it was an important person, in order to silence them, they used the mental hospitals, just as they did with me. In the book Heartless, I describe all of the terrible things I saw and witnessed, and many of us would like to think that we've really moved on, but I would say that we still haven't. We're better, but while the government is still getting private companies to bid to provide care at the lowest possible price, and they then have low-paid, untrained, overworked staff in their care homes, these kind of things are going to continue. You've got similar things happening in elderly care as well, and where they've withdrawn a lot of services, we have people in their own homes left in nappies all day, just staring at four walls. These are the physically disabled and the elderly. Nothing's going to change. We either have to admit that we don't care and say, well, we're not going to spend any money on it, or we have to start putting money in it. Unfortunately, to provide good quality care, it costs money. Up and down the country, there are people providing excellent care for members of their own family using the paltry carers allowance, and these same people are having services withdrawn from them that they require in order to do this job properly, such as respite care, or they're afraid to put their relatives into respite care because they're promptly then abused, as has been seen in these most recent reports and in the newspaper. And people seem so sort of surprised at this kind of thing, when actually it's been going on for years, right from the Victorian era and before. And it's government has always said it's going to improve things, but these things continue to happen. I suppose the only difference is the scale at which it's happening. I would say that possibly less happens now because there are some good homes. But as I have reached over 60 myself, I'd be absolutely terrified to go into some of the nursing homes and the old people's homes. I mean, obviously I haven't reached that stage yet, but should that get to that stage, they're even using court orders to allow them to remove human rights from the elderly in order to lock them up in care homes and stopping relatives from visiting or taking them out for the day, on the grounds that the relatives, who've become pretty sick of the so-called lack of care, that they may indeed want to take them out of these homes. And because these patients I'm talking about may have dementia, the social services become involved and force them to remain in these care homes, which may well provide appalling care. Sitting in chairs all day, staring at a telly on a channel that they may be completely disinterested in. No music, no entertainment, no outings, all to save money. Nobody wants to spend their twilight years sitting in a chair staring at four walls. Nor do they want to spend their twilight years sitting in a day room staring at another group of elderly people and not being taken out by their relatives and their friends. Something that I think relatives and friends should be doing is taking such people out and about, taking them shopping, taking them to the cinema if they're capable, taking them swimming if they're capable. Being old does not mean you have to sit in a chair and stare in four walls, but unfortunately a lot of care homes, that's all they actually provide, which is wrong. And that's also happening in care for those with learning disability. Some community homes literally only provide a day room and a telly. Yes, they may feed them well, they may help them wash, they may all of those things, but they're not having a good life. They're not prisoners, they're people. So let's start spending the money that we need to spend on care. And unfortunately, it's very expensive. And once more, it has to come out of our taxes. This is Stephen George. Bye.